This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, July 6th. Welcome to Africa 54. We're still working remotely because of the coronavirus pandemic, but we haven't changed our commitment to bringing you the latest and most important news from the African continent and around the world. Here is today's Africa 54. We begin in Nigeria, where anguished parents are suffering on Tuesday after more than 100 school children were kidnapped Monday at a boarding school. Police and members of the military are pursuing the perpetrators. We get more in this report from Freddie Joyner.
About 150 students were missing on Monday after armed men raided a boarding school in Nigeria's Kaduna state, the latest in a wave of mass kidnappings targeting school children for ransom. Police said they were in hot pursuit alongside military personnel. The attack on the Bethel Baptist High School is the 10th mass school abduction since December in northwest Nigeria. Parent John Evans said he had recently told his daughter that God would protect her while she studied at the school.
My daughter told me, Daddy, I don't like this school. Remember me in this school. I said, Daddy, baby, you are starting an exam on Monday, and I'm told by Friday you'll be vacated. So just be patient. Just this morning, at about 6, I received a phone call that they have entered the school, kidnappers, and all our children are packed, including my daughter inside. We rushed down here. We confirmed that they are all packed.
Dozens of distraught parents gathered at the school compound, some weeping and crying out, standing in groups awaiting news. Police said gunmen shooting wildly attacked overnight and overpowered the school's security guards, taking an unspecified number of students into a nearby forest. A police statement said 26 people, including a female teacher, had been rescued. Armed men, known locally as bandits, have made an industry of kidnapping students for ransom in northwest Nigeria, with Kaduna State particularly hard hit. They have taken nearly 1,000 people from schools in the last 8 months, more than 150 of whom remain missing.
Freddie Joyner of Reuters filed that report, worried by the disturbing revelation that 1 out of 7 Nigerians engage in drug abuse. Some youth organizations in the country are advocating for more community-based, knowledge-driven efforts to reverse the trend. VOA Hausa reporter Ilyasu Kasim has more from Jos.
A group of young people in Nigeria's north-central city of Jos, listening attentively as an official of the country's drug law enforcement agency explains the dangers of drug abuse to both people's health and the security of the country. It was a sensitization gathering organized by a local NGO, Youth Awareness Forum on Drug Abuse, as part of community approach to solving one of Nigeria's major problems, drug abuse.
We organize this sensitization in view of the way our youths are destroying their lives through drug abuse. It is rampant among male and female youths. We cannot wait for the government actions alone, because even when offenders are arrested and imprisoned, they go back to drug abuse after their release. Imprisonment doesn't stop them. So the best solution is to educate young people on the dangers of it.
Nigeria's Drug Law Enforcement Agency says abuse of drugs such as alcohol, marijuana, cocaine, urine and tramadol, among others, is increasing at an alarming rate in the country. The agency says more than 10 million people are currently abusing drugs and that 1 out of 10 is a woman. Participants at the sensitization program learned about the signs to look out for when they suspect a relative or family member might have a drug problem and how to treat them.
I have learned a lot from this program. We have family members that we stigmatize because they abuse drugs. Today we learned about how to approach them. We learned that stigmatization is not the way to help them to stop. As women, we are responsible for the upbringing of our children at home. I have children and grandchildren, some of whom are using drugs. We are so pleased with this workshop. It will really help in fighting the problem.
Speakers at the program say drug abuse, which also contributes to domestic violence, is likely going to increase unless all stakeholders, including religious and traditional leaders, intensify sensitization initiatives in their communities. Ilyasu Kasimu, VOA News, Jos, Nigeria.
The government of Eswatini, formerly Swaziland, says life in the country is returning to normal following days of deadly protests. Government spokesperson Sabelo Dlamini says the protests cost an estimated 3 billion in Eswatini currency to the economy, and an estimated 5,000 jobs were lost due to the destruction of many businesses. Dlamini says the people of Eswatini are proud of their tradition to resolve their differences without resorting to violence. Conservationists in Zimbabwe are trying to rally opposition to a Chinese coal mining project operating in the district with the country's biggest national park. Critics say locals and wildlife will be affected and are urging authorities to move away from coal production toward renewable energies. Columbus Mavunga explains from Zimbabwe's Hwange district.
Most Dinde villagers in Hwange district say they are opposed to the coal mining project by BEIFA Investments, but many are unwilling to speak up for fear of retaliation. About 600 families fear being displaced if the coal project goes ahead. One of them is Maurice Sebanda.
At the same time, fearing that any time I can be evicted. Secondly, our grazing areas, we've got a river called Inyantuwe, that's where we get water. It's our main source of water. So definitely when this mine succeeds, my fear again is that toxic acids might be found in the river.
Other villagers are worried that the project will take away grazing land for their cattle and wildlife. But BEIFA Investments continues with its exploration project. Zimbabwe's government says Dinde people were consulted before the company was allowed to start mining. Amkela Sidange is the Education and Publicity Manager for the government's Environmental Management Agency. She says an Environmental Impact Assessment EIA report addressed and cleared all Dinde's concerns.
Their fears, they are all taken care of. In fact, as long as the EIA was done, it's being monitored by the agency, so nothing is going to be done which is outside what the agreement was in the EIA for exploration.
Farai Magu is the director of the Center for Natural Resource Governance, a local NGO. The group is opposed to the Dinde coal mining project, partly because there are no clear plans on where the villagers will be taken if they are displaced. That's not all. Magu says coal mining undermines Zimbabwe's plans to build a green economy and to reduce carbon emissions by 33% by 2030.
But that will not happen as long as the country continue to invest in dirty energy, as what is about to happen in Dinde. We will not allow the government to continue talking left and then walking right.
Sibanda, like most villagers around here, says he does not know what tomorrow will bring. The villagers fear that more coal projects will be approved and encroach into Hwange National Park, the country's largest wildlife sanctuary. Columbus Mavunga for VOA News, Hwange, Zimbabwe.
The co-founder of footwear startup and SPORTSWEAR says it is seeing a boost in sales from people stuck at home during the pandemic, and says manufacturing could also help Kenya recover from the economic impact of COVID-19. David Doyle has the details.
In the Kenyan coastal town of Kilifi, new pairs of running shoes are coming off the assembly line. Though the global health crisis has been devastating for many businesses, the co-founder of Enda Sportswear says it's allowed her business to take great strides.
The industry, it just went up.
Navalayo Osembo-Ombati is a trained lawyer and accountant who started out 5 years ago with a dream of leveraging athletic shoes off the legend of the country's runners. She's now trying to build on a bump in sales over the past year.
running was the only thing allowed by most governments. It was the only other thing people could do by themselves in the open because gyms were closed.
But Ender, which was built on $120,000 raised from crowdfunding platform Kickstarter, is an exception. A World Bank report in November warned that the pandemic has pushed 2 million more Kenyans into poverty. Osembo-Ombati says manufacturing can create much-needed jobs, but she's frustrated at how difficult it is to secure capital in Kenya, citing legal requirements such as physical security.
Again, in addition to contract manufacturing, we have to really make crowdfunding popular in Kenya at least, or in Africa, because that way it removes all those gatekeepers, all those challenges you face on a day-to-day. It just basically means your idea stands for itself.
To free up funds, Ender teamed up with Umoja Rubber, a company that's been making shoes for the Kenyan market since the 1970s. It produces the running shoes, allowing Ender to redirect capital that would have been needed for facilities and machinery. Today, Ender's shoes are heading to domestic and international clients, and Osembo-Ombati's ambition is to take Ender Sportswear to the top 3 of global sports shoe companies in the next 5 years. In business, just like in athletics, she says, a podium finish matters.
That was David Doyle of Reuters reporting. Between 800 and 1,500 businesses worldwide are feeling the effects of a ransomware attack centered on U.S. information technology firm Kaseya, according to its chief executive. Fred Bocola, the Florida-based company's CEO, said in an interview that it was hard to estimate the precise impact of Friday's attack because those hit were mainly customers of Kaseya's customers. Kaseya provides software tools to information technology, outsourcing shops, companies that typically handle back-office work for companies too small or modestly resourced to have their own technology departments. The hackers are demanding $70 million to restore all the affected businesses' data, although they have indicated a willingness to temper their demands in private conversations with a cybersecurity expert and with the Reuters news agency. Let us know what you think about Africa 54. Join the discussion on Facebook. Our address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, a Paris-based music festival launched its first ever digital event dedicated entirely to Africa. We'll be right back.
Join me for the next Straight Talk Africa. We'll look at the human experience of refugees. Can those who have escaped disaster and conflict be made to return to the place they fled in the first place? And what happens between those who leave their home countries and those who stay behind? We'll also bring you a VOA special report on the lives of refugees around the world. So join me for that on the next Straight Talk Africa.
Welcome back to Africa 54. As the dangerous Delta variant COVID-19 sweeps across the world, a new study by the U.S. Centers for Disease Control and Prevention found that pregnant women are getting vaccinated against the coronavirus at a lower rate than their non-pregnant peers. Experts say most pregnant women infected with COVID-19 will be asymptomatic or have a mild disease, but their health may deteriorate rapidly, affecting the fetus. They say a lack of outreach and engagement with pregnant women, as well as delayed or even inaccurate information, is causing some distrust in the vaccine. Africa 54 health correspondent Lino Mudu spoke with Dr. Rahul Gupta, Senior Vice President and Chief Medical and Health Officer at the March of Dimes, a United States nonprofit organization that works to improve the health of mothers and babies.
What we do know, as a matter of fact, is that so many more pregnant people have gotten the vaccine. And from the registries that we have, a follow-up of those pregnant people, we're seeing that the outcomes have been really good. So we have a lot of confidence in the vaccine to be safe and effective against pregnant people. Although recognizing the fact that there was no initial studies done, but we do have a post-marketing data that supports that. It is very important to get vaccine when you are pregnant or anticipating pregnancy. And we know evidence that if you are pregnant as opposed to your non-pregnant cohort, your likelihood if you get the infection is much more to have severe disease, end up in a hospital or an ICU, or even unfortunately die. There's another point I want to make to you. Generally, we believe asymptomatic infections are perhaps of less consequence in adults, in children overall. However, that may not be the case for pregnant people. And Marcia Dimes is in the front lines helping fund research right now to look at the role of asymptomatic infection on placenta, in pregnancy, on preterm birth. And, we are concerned that the asymptomatic COVID infection may actually have adverse outcomes. This is the reason, one of the reasons that we really recommend that people who are pregnant or are anticipating pregnancy or planning pregnancy should really have a conversation with their healthcare provider about getting the vaccine because of these types of risks that we are either know or we are investigating.
Some women will say, listen, when we get pregnant, there are some vaccines that are recommended that we do not use. The HPV vaccine, the MMR vaccine are not recommended for pregnant women. So what makes COVID vaccine safer for a woman and her unborn baby when we know that this vaccine has been used for less than a year?
One of the things what we do in medicine is, we generally do not recommend any live vaccines. That includes even what used to be the nasal part of the vaccine for flu, which was attenuated, meaning it didn't have the ability to cause infection, but we still did not recommend that for a pregnant person. That is not the case with any of the COVID vaccines. These vaccines cannot and do not have the ability to create or cause infection in your body. They are very quickly disseminated because they lead for mRNA vaccines especially, and the majority of these have this mechanism that they cause your body to create a spike protein and then antibodies to react to that spike protein, just like if it was an infection. So these vaccines do not have any potential to cause the infection itself, because what we know about the science of the development of vaccines, of these vaccines particularly, they seem to have been pretty safe and pretty effective. But we would still stand by that in pregnancy, you definitely should not be getting administered any live vaccines.
A new report by the US CDC found that pregnant women are being vaccinated not only at a lower rate, but those disparities exist, which you mentioned earlier. Could you elaborate a little bit about what some of the barriers are and what strategies and approaches could help expand vaccination coverage among pregnant women from the March of Dimes perspective?
So I think it's really important for us to understand that, some of the lack of the early safety studies, some of the reasons for distrust is false information that has often been disseminated about the safety of the vaccines, the important role of prioritizing vaccinations for pregnant people, especially in communities of color, and crossing those cultural and language barriers. Those have been some of the challenges that have yielded a much lower response. 1 in 6 pregnant women getting the vaccine, we could have done a better job. We need to make sure we have a campaign, both at a national and a local level. The movement that Marcia Dimes is engaged in, education of both individuals, the physician community, the provider community, as well as the other participants of a community, faith-based groups, businesses, and others that understand the importance of vaccine, not just to the safety and health in pregnancy, but also to the economy and work, and be able to have the family around you in a safe atmosphere. So it's going to be very important that we begin to work and continue to work, especially in populations of color, to make sure that there's equitable access, distribution, and knowledge sharing that allows people to have a higher level of trust in the vaccine, and then be able to speak to their healthcare provider and make informed scientific science-based or evidence-based decision that helps protect them and the baby as well.
Thank you, Dr. Rahul Gupta. We appreciate your time.
Thank you, Lenore.
That was Africa 54 health correspondent Linomu Duo speaking with Dr. Rahul Gupta, Senior Vice President and Chief Medical and Health Officer at the March of Dimes. Pandemic, economic pressure, and more state limits on abortion are driving an increasing number of women, especially the poor, to Washington, D.C. to terminate their pregnancy. VOA's Veronica Balderas Iglesias explains why.
Since January alone, at least 83 abortion restrictions have been enacted across 16 U.S. states, according to the Guttmacher Institute, a reproductive rights group. Most affected, women of color, especially those left jobless during the pandemic. One result, abortion demand is sharply up in states like Colorado and in Washington, D.C., where access is easier. In the nation's capital, the DuPont Clinic has seen a 10% increase in patients from other states since March 2020. Half don't have insurance and can't pay the cost of up to $12,000 for the procedure. So, nonprofits fill the gap, as the clinic's co-founder, Maritza Arias-Bazemore, explains.
We collectively, through all the funds, provide the help that they need. It's not limited to just the financial, but it's also including the transportation, the logistical support, transportation, hotel, etc.
The all-volunteer DC Abortion Fund is among the nonprofits raising money to assist. Requests are up, primarily from women who've lost low-wage jobs.
For the first 5 months of 2021, we have pledged over $100,000 each month. That's more than twice what we usually pledge. So we're doing our best, but it's completely unsustainable.
We want to stop abortion. We want to protect those babies.
Pro-life groups want abortions banned and are mobilizing to oppose the Biden administration's proposal to Congress to eliminate the Hyde Amendment, which prohibits using taxpayer money for abortions.
The Biden administration is the most rabid, radical, extreme pro-abortion administration that we have ever had. So we want everyone to be talking to their members of Congress to put pressure on them.
Also in Congress, anti-abortion forces are fighting the Women's Health Protection Act, legislation that could roll back abortion limits in the states.
Would strike down health and safety protections, would strike down informed consent provisions, would strike down late-term abortion protections, and we're talking about nearly every state in the nation has these types of laws.
Yet, in states where new abortion limits are in place, abortion rights activists worry most about the so-called Texas heartbeat law. It bans abortion after around 6 weeks of pregnancy. Unrelated parties would get the right to sue abortion providers. Brittany House had an abortion in 2012. A volunteer for the pro-choice group Planned Parenthood, she says the stigma for terminating pregnancies, especially for poor Black women, needs to be overcome.
You don't want women to have abortions, that's fine. However, what social equity programs are out there in the states that are having these bans that will help women not have abortions, right? Are you increasing SNAP benefits? Are you increasing child care benefits? Are you increasing transportation? Like, what are you doing to ensure that women don't have abortions?
Under the 1973 U.S. Supreme Court ruling, Roe v. Wade, abortion is legal. But how far states can go to restrict it is an ongoing political and legal battle.
We need to be open to understand the arguments that each side offers and hopefully get to some kind of middle ground that will ultimately support the health of women and their families.
In May, the Supreme Court agreed to hear a challenge to Mississippi's ban on abortions after 15 weeks of pregnancy. Now, with a solid conservative majority, the court could upend 48 years of law. Veronica Balderas Iglesias for VOA News, Washington.
The Paris-based international music market and festival known as Midam launched its first ever digital event dedicated 100% to Africa. It took place from June 28th to July 1st as a Pan-African event with Kenya as its country of honor. Host of Music Time in Africa, Heather Maxwell, speaks with the MIDEM's director to find out how it went.
Hi, my name is Alexandre Degnaud. I'm the director of MIDEM. I'm based in Paris, France.
Is this the first time that MIDEM has done a conference in Africa for Pan-African music?
Actually, it's the first digital event dedicated to Africa, but we've been to Africa for the last couple of years. We did 10 events in 7 countries. It was essential for me to start, by meeting people face to face. And now, due to the situation, we go digital, but it's a good opportunity anyway for everybody to be able to connect.
So how are people connecting digitally?
So thanks to our platform, so you go on midem.com, you are able to have access to different tools. So like chat box, virtual meetings, contact recommendations. So we are here to facilitate the networking. And also we organize networking sessions during our event.
Will listeners and viewers watching right now be able to access any part of this conference after the fact?
Yes, because on the platform, the content remain on demand. So if you are late, if you are missing what we're doing right now, you're going to be able to see it again. All the content remain available. And also because we have more than 14,000 members on our platform globally, you can still network with people. So the platform is here for the music community.
That's great. So what about Kenya? Kenya was the host country. What does that mean for Kenya?
It means we give them like a special spotlight. We promote the quality of the music market and also the artists in the country. That's what we do and try to really support Kenya as much as we can.
Well, this is really exciting, Alexandre. What about next year, MIDEM Africa 2022?
Yes, we are for sure. We definitely continue what we are doing, supporting the structuring and professionalization of the markets in Africa, supporting our community in Africa. So hopefully we're going to be back on the continent. That's why I really want to do. And if not, we still have the platform and we continue to do things for Africa and with Africa.
Well, thank you very much.
Thank you very much for having me. It was a pleasure.
Thanks, Heather. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.